just check for input. She's back here getting on the
Okay. Are we ready? I can call Ingrid real quick.
At the bottom, it says Ingrid. She's just here. She's just joined via the Zoom.
Okay, wonderful. And Carol and Kim, are you joining us by Zoom or are you in person?
I'm in the pair room.
You're in the pair room. And Carol, you're calling in?
I am.
Okay, no problem. All right. Thanks so much. All right. Well, hello, everybody. Wanted to do a quick disclaimer. We are recording this meeting. Welcome to the very first nominating committee of the cost board. Thrilled that Kim, Carol, and Ingrid have agreed to join us. We have a very packed agenda for an hour meeting, and let me just go through that really quickly, unless I'm missing something else that I need to disclose, and I'm going to look at Mandy and Rochelle for that. Hearing none, I'm going to go ahead and get started. Let's go ahead and move to the next slide, which is the agenda. Hello, Ingrid. Thanks so much for joining us.
Hi, thank you.
So, want to let everybody know that we're going to do welcome introductions. Actually, I think all of us know each other in terms of Kim, Carol, Ingrid, Mandy, Rochelle, and Teresa. And so I think Kim, Carol, and Ingrid are all three on the cost board, and they have agreed to be part of this nominating committee. And Mandy, Rochelle, and I are staff with the cost board work and the committees. So we're happy to be here. Wanted to just go through the agenda really quickly, which is that we have an opportunity for public comments, and we have a few people on the call. I'm not sure if you're here for public comments or not, but we'll let you raise your hand and let us know that in a few minutes. But let's go through the agenda first. We are going to review the cost board approved nominating committee charter. We're also going to talk a little bit about a nominating committee application as well as timelines. You're only approving the nominating committee charter, which is really was already approved by the cost board. So if you had any changes to that, we could go back to the cost board and say, hey, the nominating committee would like to change this. But otherwise, it is the charter that the cost board, which means the three of you, approved. And then we'll just go through sort of a draft nominating committee application, which we've never had before, but actually borrowed some from both the Health Benefit Exchange as well as ERB. So there's some opportunities there to look at how we might go forward in nominating folks and have other people nominate, the nominating committee process. And then a little bit about the timelines and what we're thinking about for the rest of the year. Then we're going to talk and hear from Rochelle about the 1508 updates and what that means for the current Carriers and Providers Committee and how we're changing that to be the Carriers and Stakeholder Committee. And then we're going to look at the nominations that have come in already. We have 2 replacement committee members, and then we have 5 new members based on the 1508 opportunities. And then we'll wrap up and talk about next steps. Any questions before we get started? All right. Hearing none, I'm going to let Rochelle do the public comments because you're in the room and can control who has access. Is there anybody that on the call? I've got Bo Reitz, Katrina Lamarche, Mark Pregler, Peggy, hello, Sharon, a Zoom user who I don't know who that is, and then Shelby, who is the Zoom only user. Are there any hands raised that would like to participate in public comments?
There's no hands raised. There's no hands raised right now, Teresa.
Okay. I want to make sure. So we've reached the time frame. So, well, we can't start till 2:10. So I'll wait for another minute. So let's go look at the, let's pull up the nominating committee charter while we're waiting to see if there's anyone, because I want to make sure that we allow for that opportunity if there are any. And I see that there's Thanks again, Shelby. Okay. So again, this was approved by the cost board. Were there any questions from Kim, Carol, or Ingrid about this? No? Okay.
No,
Again,
thank you.
we don't have to approve it since it was already approved. I just wanted to give the new nominating committee an opportunity to review it. Okay, great. Thanks so much. All right, I'm going to ask one more time. Is there anybody that has any public comment?
No hands raised.
Wonderful. Okay, let's keep going. All right, so after the nominating committee charter, we put together a draft nominating, keep going, nomination application. And it's just a way to sort of standardize the different ways people are nominated to this committee. And it's a way to sort of say, here's what we're looking for based on the 1508 mandate. And then also to just sort of have a standard. Are there any questions or comments about this from the committee?
Was there one previous slide about the nomination application that we zoomed by?
I think there's another one. There's another slide next, an additional slide.
Okay, it's next. Okay.
Thank you.
Oh,
and
okay.
again, this was in the packet that we sent out.
Yeah, that's what I thought there were two slides. Okay.
This isn't meant to be exhaustive. It's really just meant to be a template. Go ahead, Ingrid. Yes?
Oh, just a suggestion. The last slide again, please. The one, yeah. Thorough knowledge and understanding of cost growth, data systems, and the different entities and complexities that make up the healthcare ecosystem.
Mm-hmm.
I would just say, I would maybe take out the word
Thorough?
because that is an enormous body of knowledge that I think people are at different levels, and I just wouldn't exclude. I think it's maybe an equity issue just to not assume that we all need a PhD in this to participate.
Also, I'm not sure how we define thorough.
Yeah.
Carol or Kim, any comments with that? You good with that?
Good with that suggestion. Thanks.
Thanks, Carol. Yeah. Kim?
Yes, that's fine. I noticed that I didn't understand the difference between sub-I, 2I, 3I, et cetera, and then 1, 2, 3. But I think that the numbering system was, I mean, I understand the context.
Oh, I think the numbering system's a little bit, yeah, that was probably two different groups coming together to decide how to do that. I think it should be 5, 6, 7.
Well, actually.
No, actually, sorry. Go ahead.
Right. Actually, the first 4 items are about the type of relevant or lived experience or expertise, you know, the areas that people might bring. And then 1, 2, 3, you know, seem to be factors that are things that we would, data points, you know, about a nominee that we would want to have information on, right? We would want
to create sort of a diverse community, a diverse committee and a diverse.
Right. They're a little bit different, 2 lists with a little different reason, different purposes.
I think that's correct.
Because I think it's understandable when you read it.
I think we went back and forth on that, but yes, I think that's actually where we ended up, which is why it's in the slide. Thanks for calling that out. Any other comments about the application? And again, we can iterate this as we go forward. We're not necessarily approving it. It's more just sort of a thing that we will use as a standard.
Okay.
I noticed that one of the things I know, oh, sorry.
It seems like geographical location and Washington County you live in. I just, you know, if you want to, it seemed redundant to me. But county you live in may not get specific enough. So just where you reside.
Oh, where you reside. I like that. That works. Ingrid, Kim?
Agree.
Yeah, that's fine. I was just noticing that when I think about reason for interest in serving and that we are supposed to review nominations based on that information, I think I recall that there was quite a different level of information provided from the nominees about their interest in serving. And so that's one thing I noticed, that some nominees wrote directly to the board expressing their interest in serving and describing it, and others did not.
Mm-hmm.
And so I remember thinking, well, there really isn't a statement about interest from person X. And I didn't know what to do with that, you know, whether to, I noticed, but I didn't know whether to, you know, how to account for that, or if that was an issue at all. You know, I certainly found the qualifications and background and experience of all of the people that we're reviewing to be exceedingly, you know, to be relevant and impressive.
Mm-hmm.
So it's not my comment is not about their qualifications, but I did notice that the, you know, just the direct expression of interest in serving, I don't think we got information from all of the nominees.
Which is part of why we put this together, because we realized that we had sort of said, hey, let us know if you're interested, especially with the 1508 coming out, and realizing we didn't really have a structure. And so it was, so we got them by email, and so it really more formalizing the process and more sort of having it be more of a template than, and more of like not 10 pages. But so the next slide talks a little bit about that, but you're right to call that out. It was a little bit different.
It wasn't
to the next slide.
Requirements. It's not, we're not, I understand.
No,
I think what
I'm
you're
sorry.
saying,
Can we go back to the slide that talks about, yes, that one. Sorry. Thank you. Go ahead, Kim.
I think what we're saying is that there were not explicit formal requirements for the nominee, the packet or the submittal. And so it's not as if we are missing a piece or missing information from any of the current nominees. Is that correct?
Correct. We didn't standardize or even ask for specific. We just, when we found out about 1508 and wanted to act on it quickly, we just sort of put it out there for folks.
Oh, thank you.
And so to nominate folks. And so this sort of begged the question of, let's create something that's a little more standard.
Hey, Teresa.
Yes.
Not to overanalyze this, but on the location of where people live, just to be clear, are we preferring Washington State residents versus like national experts? And if so, just however that's worded, it should make that clear. I'm assuming we want Washington State participants only, but if that's my comment.
Okay. Carol or Kim, do you want to weigh in on that? I believe it is Washington State. I'll look to Mandy and Rochelle to correct me if I'm wrong on that. We have other forums where people outside of the state can weigh in. And maybe we could talk about that a little bit further down the road. But for this intents and purposes, I think it is Washington State, represent Washington's diversity. It is a Washington committee.
Yep. Thank you.
Kim or Carol, any disagreements with that? I see Kim nodding her head. Carol, you're saying you don't have any disagreement with that. Perfect. Okay. All right. Again, I think we can revisit this as we get other new applications coming forward or something. If we go, wait, we really forgot to add this, we can always go back and iterate it. But for now, this will be sort of what we send to folks who are interested in joining a committee. Great. Okay. Can we look at the time? Oh, yep.
Did you still have your hand raised?
Oh, I'm going to take it down. So sorry.
Oh.
All right. Oh, super. Thanks for seeing that. I missed that. So let's go to the next piece, which is just, this again is not written in stone. It's just when we recruited the three of you to participate in this, we sort of said it'll be about 3 meetings, and this is what we're thinking it's going to be. Essentially, we'll bring whatever we have action on today to the cost board's next meeting. And then we'll sort of look between August and September, we'll start to look at sort of current cost board committees, where they are, who's showing up, are people, you know, who are on the rosters, are they coming, are they not coming? If they're not coming, we'll check in with them, we'll do some follow-up, we'll sort of understand what the vacancies are, what unfilled positions are, and then do a recruitment process for those. And then this group will come and meet again, at least once, maybe 2 more times for the rest of the year between August and September, likely. And then November and December, the cost board, whichever their meeting ends up being on, will end up acting on the recommendations. But this committee makes recommendations to the cost board on who to basically accepts our nominations or denies them in terms of putting folks on the committees for the cost board.
And then Teresa, can you remind me if there are terms? If there is
We do not have terms, which is something we might want to discuss. We don't have terms for cost board members or committee members. And we don't have mandatory participation. We don't have, if you miss 3 meetings, we don't have any sort of definition. One of the things that is, I don't know if I actually put it in here, but one of the things that I've done in previous roles is actually having committee members and board members sign something that says essentially, this is what I'm signing up for, which is I will come to the meetings, I will read the materials. It's not a huge heavy lift, but it is sort of saying, this is what I am committing to do.
I believe that some of the board members have been appointed for a certain term amount of time. So just FYI, I think
all right. We will look. So we will look into this. We're really starting to bring some formality to the process. So I think that that's a good question. It was my understanding that they didn't, so that might be my mistake. We'll look at that.
That's correct. They have rotating terms.
Right. My appointment letter does designate a certain time period.
But not all the committee members do. Like the data committee
That
does
is
not.
correct. The committees do.
Right.
It's the board.
It's the board that does. Okay. But the board still doesn't have a commitment form or anything that the board signs.
They would sign that with the governor's office.
So Carol,
Right.
you guys do have a committee, something that you sign?
Yeah.
Great.
And the training that we had to go through.
So we have some onboarding that happens with committees, but we don't have any official training that I'm aware of.
For
committee members?
We meet with committee members and provide an overview.
Yeah, so I mean, we have an onboarding process, but we might, again, as a committee, we may want to look at some of that down the road.
Yes, sounds good.
Okay, so that's the timeline. Any questions?
No, thank you.
All right, super. All right, let's go to the 1508. Rochelle's going to talk a little bit about that. Go ahead, Rochelle.
Thanks, Teresa. Okay, so we went over this at the last board meeting, so I know this is, a repeat for you guys. But just a quick overview of 1508, there was a committee expansion. What was previously known as the Provider and Carriers Advisory Committee will now be referred to as the Healthcare Stakeholder Committee. And we will be adding additional committee members. And that is why we're here today to review some of those nominees. Another update for 1508 is the expansion of potential cost driver analysis. There will be 2 biannual surveys to take place. And those surveys consist of out-of-pocket costs and premiums. And the other survey is the insurance trends among employers and employees. Changes to legislative report timing. So previously, the legislative report was due on August 1st. It'll now be moved back to December 1st. Additionally, there'll be a public hearing on healthcare cost growth report, which will take place either in November or December this year. And there is best practices analysis, which is a new assignment from the budget. And just to go a little bit further in depth on the committee expansion I mentioned. So as I said, what was originally referred to as the advisory committee of providers and carriers will now be known as the healthcare stakeholder advisory committee. And this provides voices and representation for consumers, labor purchasers, and employers as well. So as you can see here, the member makeup, though there will be at least 2 consumers, and these are selected from a list of nominees submitted by consumer organizations. And so Mandy and I and some of us here at HCA, we were working behind the scenes to get these nominees. So for the first one, the 2 consumers, we have been in touch with Northwest Health Law Advocates, and you'll see some of the resumes and bios coming up that we're going to go over. And we do have nominees for that. At least 2 members representing the interests of labor purchasers, and we have nominees from the Washington State Labor Council. And then at least 2, including at least 1 small business representative. And we do not have anyone yet representing large employers, but we do have small employers represented so far. We have received nominations from NFIB, which stands for National Federation of Independent Businesses. Oh, and do you guys have any questions on this before we move on to the nominees?
I do. I think you sent information about, when I look at this and I see member makeup, I think this table is articulating the new members.
Correct.
Right?
Yes.
So these are the new additional 6
Right.
seats. And that I know that the original bill, the law, articulated, it had a list of the, how many providers and medical and nursing and, that, all of that, right?
Yeah.
And so there are, including these 6, there are how many seats established on the committee?
I did send that to you guys in an email. Let me see if I can.
Yes. So while you're doing that, Rochelle, let me just add that, so 2 of our nominated folks today are actually replacements for current committee members. And I wanted to mention that we are expanding. We are not replacing, so we're basically calling it the Healthcare Stakeholder Committee, but we're actually replacing some of the current people that are on it by folks like the person from KP is no longer on the committee. So we've actually got somebody to replace him from KP as well, or actually from the Washington Washington Alliance of Health Plans to replace him. And that is Paul
Association of Washington.
Schultz. Thank you. The Association of Washington Health Insurance Plans.
Yeah.
I can't remember what it is off the top of my head. And then the other one, Narman Hesmati is an MD, and he is replacing the current person from the I'm sorry, looking at my notes, from the Washington State Medical Association. So those are 2 folks that we're basically taking action on to replace 2 current people. And then the other 4
Are the new. So
Patrick, Emily, Adrian, and Justin, other 5, and Sulan are folks that are new based on the expansion.
17 previous positions.
17 positions, and then and how many new positions?
6, but you have nominees for only 5 at this time.
6 additional positions.
6 additional positions.
Okay, so 6
Minimum.
6
Right.
additional positions, but we have 5 that are coming forward. And then 2 of the people that you have in your packet are replacements for people who are either placeholders on the committee, but don't have the qualifications per mandate, or they're replacing someone who is leaving.
Teresa,
Right,
question, who's the WISMA, the Dr. Heshmati? Who would he be
Yes,
replacing?
he is replacing Jeb, Mandy Jeb's last name.
Sorry, Jeb is just temporary though. The person, I would have to go back and look it up because the person retired a couple months ago and Jeb has been filling in. So,
Yeah, he was
Jeb
serving
has
as
been-
an interim.
He's serving as interim right now. He's a non-voting member serving as interim right now on the Providers and Carriers Committee until this committee was able to meet. Jeb from WISMA, and
Jeff Shepherd.
Jeff Shepherd,
Yes.
thank you.
Yep, thank you.
But he is not a provider, so he cannot serve on the committee, which requires a WISMA provider.
Oh, okay.
Thank you. I don't see Jeb on the list of advisory committees of healthcare.
He would not be on it because
Okay,
he's just.
all right.
He was just filling interim. Good, good, all good questions.
And then what I was sharing right here is this is the language that is in the bill originally for the providers and carriers. So you can see where it says the boards shall establish an advisory committee, and then these are the committee members that shall be appointed.
Right. And that's a list of 17 there?
Yes.
Okay. So that's a 17, and then there are 6 additional actual seats.
Yes, based
Okay.
on the 1508,
Yeah.
which is expanding that committee.
Okay. So there are 23, at least 23 seats, positions. And then, and Dr. Ashmati's replacing Jeb, who was serving in a non-voting interim position and for someone. And then the other replacement is, I'm sorry, I didn't catch that.
The other replacement is Paul Schultz from KP, who is replacing on the list Justin Evander from Kaiser Permanente. And Paul has been, is not being nominated by the Association of Washington. It's in the stuff, let me find it. He is in the Association of Washington Health Plans, which is required. And we have Peggy Fu, who is the one that nominated him, and she is on the call today.
Right, great. Those are the 2 replacing.
Correct. And at least Paul's been in the wings for a while for that, but. Okay, so let's go back to the 1508 to see if there's any questions from Rochelle or to Rochelle about the 1508 sort of requirements. And this is really, we were thinking about a nominating committee anyway, and then this 1508 thing came up. It was like, oh, this is a great answer to that sort of need. So really appreciate, again, the 3 of you saying yes. So any questions to Rochelle? All right, super. So let's go on to the nominating committee and the nominations. So I will just read their names and let's see if there's any questions. And then my suggestion is if there's anyone that we want to talk further about, we can take them out, approve the ones that we are okay with and sort of don't have any questions about as a group, and then take if there is anybody that we'd like to sort of talk through a bit, we can take them off and then vote on them specifically.
So Teresa, can I just ask a question before we
Yep.
do that? Just to be really clear, I think I know the answer to this, but I want to be really clear that none of these nominees are actually in competition with one another for the same seat.
Correct.
Correct. That's my understanding. Carol has a question. I'm going to let Mandy answer that before we take your question. Is that okay, Carol?
Mm-hmm.
Or Rochelle? None of these folks, so we don't have 3
That's correct.
people
So
who are...
there are at least 2 seats available for each of the positions. Like, for example, 2 consumer representatives, 2 labor representatives, and then 2 business representatives. You have 2 for each, not including the businesses, because you only have 1 small business, not 1 large business at this time. So you have nobody competing for any of the positions. And there is opportunities to add more. It's just at least.
Right.
And then Mandy, so Justin Gill is a question with WISNA, the Washington State Nursing Association, what position he is taking. But Carol, go ahead, and then we'll get back to that question.
Whew. Okay. following this is I believe I'm following.
It's following the bouncing ball. Apologies. We tried to make it as easy as possible, but it is complicated and we're replacing and adding.
Understood. What I would suggest is to consider the two individuals who are replacing two existing positions prior to the 1508 changes.
Great.
So I believe that is Paul Schultz is replacing Justin Evander.
Yes.
And oops, I lost my place.
And Nariman Hashmati is replacing Jeb Shepard, who was the interim for the person that left from the WISMA group. And Jeb doesn't have an MD, and you have to have an MD, and Nariman does. And I may not be saying his name right.
Correct.
I had no concerns. I had no concerns for those two individuals. Their applications appeared to meet the qualifications of the existing, and would make a motion to nominate those two individuals for those two existing positions.
Great. Do I hear a second, Kim or Ingrid?
Second.
Okay. All those in favor?
Aye.
Aye.
Kim, did I hear you?
Yes, aye.
Okay, great. So the nominating committee forwards both Paul Schultz and Nariman Hashmati forward for replacing the two existing positions. Great, thanks so much, Carol. Okay, so let's talk about the new folks. We have Patrick Connor, Emily Bryce, Adrian Jones, Justin Gill, and Sulyan Malyarnarek. And I may not be saying that right either. And the next time, I think we will be very clear when we are bringing new people forward and replacing folks. So that's a really good suggestion. So are there any concerns with,
I just want to point out real quick, I think this might have been a typo on here. I don't know if it's Adriana. I think it might be Adrian.
Okay.
I think
you're correct.
I believe it's Adrian. You're right.
Yeah.
Adrian Jones. Thank you. Yeah. So let's go back to the first group, because I think there were a couple of, okay. So Patrick Connor has been, put forward by the NFIB, National Federation of Independent Businesses. And Emily Bryce has been put forward by the Northwest Law Health Advocates, nominated by the CEO. Let's go to the other three. Adrian Jones of Washington Community Action Network has been put forward by the manager of the same organization. Justin Gill is president of the Washington State Nurses Association. And Sulyan Malyarnarek has been put forward by SEIU. So any questions? Let's go back to the first group. Any questions about Patrick or Emily?
I had no questions. Both of their resumes and their letters of support suggested that they were meeting the needs of the small business and
the consumer.
So I thought good applicants, good nominations.
Ingrid, Kim?
Question.
I'm looking at something on my screen for just a moment. Here.
I have no questions. I'm familiar with the individuals and reviewed the paperwork and support them. Thank you.
Thank you.
I'm just trying to open my window. I'm right here.
No worries, thanks. I heard you from a distance, so. Kim, questions?
I don't have a specific question. I think I want to share, perhaps not as a comment on any of the particular nominees, current nominees, but a thought that I had as I was reviewing all the materials. I recall that a number of them expressed or shared that they are very much sort of invested and involved and connected to efforts, in Washington, including, Cascade Care and other, alliance, like Health Alliance initiatives, et cetera, just a lot of the, and so I want to share that I have two interesting kind of reactions to that.
Mm-hmm.
One is, yay, wow, engaged, involved, knowledgeable people committed to being a part of moving in the right direction, right?
Mm-hmm.
And they're investing their time and energy and giving of their expertise. So very, very favorable reaction. That said, I also had a thought that are we somewhat at risk, the royal we, health policy leadership in Washington State, are we somewhat at risk for kind of hearing from the same people?
Mm-hmm.
And having what may feel like a broad representation of voices and perspectives, and yet perhaps being somewhat limited in that we're hearing from a small circle of people who are, again, expert and giving of their time and all that. So I'm not suggesting that there is something wrong, or inadequate, or that we shouldn't move forward with any of these nominees. They're exceedingly impressive. But I did want to raise I think as a matter of principle, or just challenge ourselves in terms of the values that we set forth, being very broad and inclusive and understanding from a variety of perspectives. It feels to me like there is a somewhat smallish a group of people who engage with large statewide health policy efforts. And, perhaps we would benefit or should consider a kind of outreach that would, help us expand beyond what our sort of most customary, what we're accustomed to in terms of our circle.
And maybe the opportunity to do that is as we expand the committee even more, and as we get some newer folks in addition to these folks potentially. And I'm hearing you say nothing wrong. This is a good slate. It's impressive. Yes. It's all the right things that we're looking for. And is there a broader way of challenging us, and I mean the royal us, the royal we, to look broader, bigger, more geographic diversity, more diversity in lived experience, just more diversity, period, as a way of, and maybe not folks who are, and look for folks who may not already be engaged to offer them the opportunity to be engaged. That's what I'm hearing.
Yes, thank you.
Teresa, if I could speak
Please.
to that. I have this habit of raising my digital hand and waiting until I'm called upon, like a good, well-behaved student.
Oh, and I really need to look better than at the panelists to make sure that I'm watching that. Okay, got it.
Kim, I just want to say I totally appreciate the point that you're making. These are some very familiar faces to different circles that many of us travel in. And it's important from an equity perspective to widen the circle, tap into a deeper bench of leaders, people with perhaps more diverse perspective and lenses on the work. So I think going forward, I think that's a really important point. I do also see some emerging leaders on this list who are not who we would anticipate from these same organizations. So it's great that I think is part of this process. Yes, there are familiar faces. And yes, I think there's a development opportunity here for some of these other emerging folks. And then, Teresa, I'm sorry, I'm new to this group. But what I'm curious about, I think going forward to diversify the pool, we would take a look at how we do the outreach so people know about this opportunity. I'm just curious, for these seats, you named the organizations who recommended the nominees. Maybe just a little more about how did we cast, how did we get the word out in addition to reaching out to NOLA, Labor Council, NFIB. How did we seek candidates?
Yeah, I'll let Mandy and Rochelle answer that. But the other thing is that some of these have to be nominated. So that's the other, some of them have to be nominated by X. So that's part of where that came from.
It's part of 1508 language.
Exactly. But there is some opportunity to self-nominate. And that's part of why we came up with a nominating committee application to really, it'll be on our website. Like if you want to apply, you can apply. And we haven't done that. So this is, again, sort of as we created this committee, the opportunity to be more real deliberate about not just sort of
like be as inclusive as we can within the parameters of how what the statute says.
Exactly.
Yep.
So putting it on LinkedIn, those kinds of things. But I'll let Mandy answer, Rochelle and Mandy answer your specific question.
You are exactly right, Teresa. The nominations are sort of governed by the statute of 1508. It says like these entities shall nominate. And so we're a little restricted under the terms of the new nomination, and we worked with the committees we worked with the entities that were involved in the legislation, reached out to those entities because we knew that they were the people intended under that legislative request from the legislature. And so that's who we worked with to sort of get those nominees from those entities. There is greater latitude, for example, under the data committee, which is not very restrictive. There is no restrictions on the data committee whatsoever as to who shall be a part of it. So that's really an opportunity for us to sort of examine how that's working in a future state, currently future state, and sort of maybe add some greater representation. I think that's really the committee that we can better get some diversity because it's more within our control than the statutorily set up ones.
Thanks, Mandy.
Sure, happy to help.
Carol, any comments?
Nope.
Okay, so with that in mind, Kim, let's go with so Patrick, Emily, can we go to the next slide, please? So any questions about Adrian, Justin, and again, I'm not sure how to say Shulan or Sulan's name. Are there any questions about the three of them? And Mandy, the WISNA, the Washington State Nurses Association, so that position for Justin Gill, what's
sorry, that's the labor position.
Labor, okay. Great.
Would it have value to nominate the positions by the category, the new categories, or just the full slate?
Sure, we can do that. We can nominate, we have Patrick Carr, so we can do these individually. We have enough time. So we have Patrick Connor as the small business. We do not have the other business position filled yet. And tell me if I've got this right. If I mess up, Andy and Rochelle, please let me know. So we have Patrick Carr for the business employer spot. we have Emily for the stakeholder and Adrian and Emily Bryce and Adrian Jones for the stakeholder and consumer committee role. We have Justin Gill as labor and SEIU Shulin as the labor voices. The labor representatives. All right. So let's take our business, to Carol's point, let's take our business nominee. We have Patrick Carr, nominated by the National Federation of Independent Businesses. All those in favor? Oh, I probably need a motion. Do I need a motion? I think I need a motion.
I think that would be good, and I was prepared to do that.
Great. Thanks, Carol.
So I'll go ahead and do that for Patrick Connor for the small business representative of the business organizations.
Second. Thanks, Kim. All those in favor?
Aye.
Aye.
I only heard two.
Aye.
Great. Thank you. Okay. Patrick is moving forward to the cost board. All right. And Emily Bryce and Adrian Jones are both of our stakeholder consumer roles. Do I hear a motion?
I'll make a motion.
Great. Thanks, Ingrid. Thanks, Carol. All those in favor?
Aye.
Aye.
Great. Thank you so much. So Emily and Adrian are moving forward. And then we have Justin Gill and Shulian Malnarik as our two folks for labor. Need a motion?
Make a motion there.
Carol, second. Yeah.
Thank you, Ingrid. Thank you, Carol. All those in favor?
Aye.
Aye.
Great. Thank you. So those both will move forward then as part of the nominating committee's recommendations to the cost board for the new committee members. And I know that Mandy and Rochelle will reach out to these folks and their nominating associations and organizations in the next day or two and let them know, and then also start to work with them to do onboarding as well as bringing them forward to the committee, which the next meeting for this committee is in June. And we plan to do some sort of change management with this group because they're changing, both so they're expanding and they're having some new folks come in. So we're going to really be thoughtful about how we do that. Thanks to everybody. Carol and Kim, your hands are raised. Go ahead. I'm not sure who was first. Carol.
Yeah. So Rochelle had mentioned in her last email that Eileen Cody is going to serve as chair for this.
Yes.
Does she have to fill a position, or is she just chair, no distinction of representation?
We haven't had a chair in either of our committees other than staff. And so this is an opportunity for us to, I might be misspeaking.
That's correct.
So we are actually creating a chair role, and Eileen is retired, so she's not representing anyone at this moment, although she's Eileen. So, you know,
I know. I just felt that if she was going to be a voting committee member, if she needed to be a represented group in this committee. So that was my question. If so, she would have filled the consumer role. So I just wanted to make sure that we're not going afoul of any rules. I didn't see any rules related to that in 1508, but
no, and I think 1508 talks about the minimum, not the maximum. So there's an opportunity to potentially, even if she did, but it's a really good question because there's no. So she agreed to be chair. We didn't bring her to this committee. I don't know that the cost board has. It's a great question.
The question is, what authority is she acting under as chair?
Exactly. And Mandy or Rochelle, do you have an answer to that? It's okay if we don't. We can go back and determine that.
There's no chair designated by statute other than I think it says like the board shall create a chair or something to that generic effect. It doesn't have to be a voting member.
You were breaking in and out there. You said something about the board.
Sorry.
The board can approve that, or I didn't hear what you said.
It's a chair created under the legislation necessarily. It's more at the board's discretion.
So the board will take action to put Eileen in a chair position?
That's correct.
I see. And that will be for the board, yeah, next, for the next.
In the
meeting.
June. In May, so before the committee meets. And we should sort of
There is
make
a liaison position for the Providers and Carriers Committee.
That makes a lot of sense.
There is a liaison position, but it is strangely a non-voting member, and there is somebody who's filling that position right now. So it's a non-voting member to the board. That's Jody. And so that's Jody. Yeah,
Jody
exactly.
Joyce, right?
Who's filling that. We want to recognize that Jody, has not been feeling well lately. So we're trying to add some additional support for her. And enable the committee, which has asked for board members to be heard by board members. So having a chair with a board member might enable that committee to feel more heard.
Great. That's a great question, Carol. I'm watching the time. Kim, you had a thought?
Yes, I apologize. I have a leadership meeting to lead. I gotta go.
Okay. Thank you, Ingrid. Appreciate it.
Okay.
Bye-bye.
Bye.
Bye. Bye. Well,
Kim?
my comment is very just kind of an editorial minor comment. I wanted to share that I noticed that we understandably, we weren't quite sure about people's names, that perhaps the spelling and the pronunciation. And so I just wanted to ask us to confirm prior to the next board meeting, to confirm truly the exact spelling and the pronunciation of people's names, so that we don't feel awkward, or unsure, so that because I think that's just it's a gesture of respect and showing that we're fully ready to welcome them into their positions.
Great comment. Thank you.
I find myself from time to time not knowing how to pronounce someone's name or not knowing how to spell it. And I challenge myself to always ask so that I can, and then I make a note of it so that I can really remember, because it's just one of those things that it's easy to gloss over and to send a different message than we intend to send.
Exactly. Totally agree and appreciate the comment. Carol, is your hand up again? Or
One final comment.
Yes,
we were talking earlier about onboarding, and just want to make sure that we're mindful of the RCW that's guiding this board subcommittees and the training that it's required to do under the governor's direction. So I think that the onboarding process and signing of forms is very laid out. I would assume that the subcommittees are subject to the same training that the board members had to go through.
I think that's a question that you're asking. I'm going to let Mandy or Rochelle answer that.
We do have them go through the training for the same thing that you were talking about. Yeah, the RCW training. And then we do a meeting before they start. It's just like a general welcome orientation meeting. We kind of lay out information about the charter, expectations, meeting schedules, answer any questions that they have, provide them an updated list of the registry with the affiliation of all the other committee members, so they're just aware of who the committee members are, and provide them links and information to previous meeting materials, meeting videos, so they can get caught up on anything that they may have missed up to that point.
Great. Thank you for confirming that. Appreciate it. Well, this has been a good first meeting. I appreciate too some of the thoughts you've given towards how we can kind of refine the presentation of nominees in future meetings. That would be very helpful in the review to know who we're considering for what
positions.
What position. Yeah, that would be greatly appreciated. Thank you.
Well, I feel like it was a very iterative process and really appreciate all of your participation. So thank you, and we'll look forward to our next meeting.
Sounds good.
Thanks so much, everybody. This meeting is officially ending at 3 o'clock. Thank you.
Yeah.
Bye-bye.
Bye.